We just have Irene joining us, then we'll get started. So it looks like we're live on YouTube. Good morning, everyone. It's Friday, November 6th. Thank you for joining us today for our COVID-19 update. Today we'll hear from Dr. Hsiu-Li Wang as well as Chair Karen Redman. I'll provide an enforcement update as well once we've heard from our other two speakers. Let's get started with an update from Dr. Wang. Go ahead, Hsiu-Li.
Good morning, everyone. Thank you for the opportunity to provide an update. So in Waterloo region over the past week, our daily average number of new cases has increased. In October, our rates were often in the range of 15 to 20 cases per 100,000 people per week. And over the past week, our rates have been between 20 and 25 cases per 100,000 per week. We are in the process of tabulating numbers for our 1:30 p.m. dashboard. So I don't have numbers for you that are exact, but I can tell you that the numbers we will report today will represent a significant jump from our average this past week. There will be approximately double the number of new cases reported than we have been seeing in the last week. So I expect a number in the 40s. This is what we are concerned about with COVID. When numbers increase, they can accelerate rapidly. We will need to double down on our efforts to stick to the personal public health precautions we can each take to slow the spread of COVID-19. The average rate of new cases for Ontario has also continued to climb, up to approximately 48 per 100,000 per week. In terms of what we've seen often drive our case numbers, it is very similar to what we've seen elsewhere in Ontario. The genesis is often at events or gatherings where people are not maintaining the precautions that they should. It's then spread to their household contacts and family and friends, which then leads to an increase in cases in community settings like schools and workplaces and care homes, which then leads to further spread and increases in household clusters and outbreaks in various settings. So it's cyclical. This is why we need to try to prevent cases as much as possible. We can't always prevent them, even when people do their best, but we must do our best to try and prevent them, to keep these cases from accelerating. Self-isolation and close contact. Our team has put together an infographic to illustrate how cases can spread in settings where individuals are in close contact with others and without precaution.
Is Dr. Wang frozen for everyone?
Yeah.
Okay. So we'll give it a second to see if it corrects, and if not, we'll go to Chair Redman and come back.
Such as
Okay, so it appears she's having a little bit of technical difficulty. These things do happen. Chair Redman, did you want to maybe provide
face coverings?
Oh. So we'll go to Chair Redman, and then it looks like
I'm back. Sorry, I got kicked off. Thank you for did you put up the screen yet? Sorry.
I haven't. So why don't you go ahead and do that, and then we'll go to Chair Redman.
There, it's working. I got kicked off. So this is the infographic. So an individual with symptoms attended a large Waterloo region, 15 more confirmed cases, and 33 high-risk contacts were identified. with more cases and contacts identified in multiple other communities as well. So as a reminder, if you are experiencing symptoms, even if they're only mild, please stay home, self-isolate from others, and schedule an appointment to be tested. When self-isolating at home, there are things you can do to limit the spread within your home. Spread, as our data shows, showed this this past Wednesday, spread amongst household contacts is the most common form of close contact spread. So whether you are self-isolating because, sorry, I'm showing my notes rather than that. So whether you are self-isolating because you are waiting for test results, have tested positive, or have been identified as a high-risk close contact and have been asked to self-isolate, please follow these steps. As much as possible, stay in a separate room away from other people in your home and use a separate bathroom if you have one. If you do not have a separate room, make sure that shared rooms have good airflow. If you do not have access to a separate bathroom, disinfect the bathroom after each use. Pay close attention to high-risk areas, such as the toilet, sink, countertops, and doorknobs. If you are in a room with other people, keep a distance of at least 2 meters from others and wear a face covering that covers your nose, mouth, and chin, and disinfect high-risk, high-touch areas and surfaces between uses. And of course, always try to practice the respiratory measures that we ask, such as washing your hands often and thoroughly, trying to avoid touching your face, and covering your coughs and sneezes. And so self-isolating and limiting contact with others when you have symptoms is really important to help slow the spread of COVID-19. I'll say a few words about the Ontario framework. You heard about the key things this past Wednesday, but one area which I'd just like to reinforce because it has a very important link with how COVID is spread is what Ontario has seen and what we have seen as well in our local data with respect to the key risk factors underlying COVID spread. So close contact is the highest risk. And so that's close, within 6 feet, prolonged contact with people that are outside of your household, and even in your household if it's in someone in a home. And other risk factors include prolonged exposure, as I mentioned, and also forceful exhalation, like when people are strenuously exercising. And crowded places and closed spaces. So that's why the measures that we've been recommending, physical distancing, staying at home when you're ill, even with mild symptoms, frequent hand washing and wearing a face covering are all key to limiting COVID transmission. And this reminds us, and it's helpful for all of us to be reminded that the risks of gatherings with people in close contact, which is often with people that we're familiar with, like family and friends, and especially in enclosed and indoor spaces, this is what's driving the spread. And so we need to understand that in order to be effective in trying to mitigate the spread and helping each of us make informed choices. I just wanted to mention that I mentioned this, I think a couple of weeks ago, but we're still seeing this trend. So I just wanted to highlight this again. Our investigations in workplace settings continue to see a number of high-risk contacts among employees. And this is related to a lack of measures or a lack of adherence to measures in employee-only areas. So as I mentioned before, many workplaces ensure that there are appropriate public health measures in areas where there are patrons. But this level of diligence is not always followed in employee-only areas. And we've seen that. We've seen spread in those areas, and that's the most common type of spread we've seen. It's not the employee to patron spread that we're seeing, which we're not really seeing. It's the employee to employee spread that we're seeing. And again, it's not enough physical distancing and relaxation of the wearing of masks. In particular, during lunch breaks, during other breaks, and when employees travel together to and from workplaces when they carpool together and they're not from the same household. So we have heard from the province that, as I mentioned, this is happening in a lot of places, and they will be assisting regions with outreach, education, and enforcement with respect to workplaces. And local public health will be working closely with them on this issue. So in conclusion, I appreciate how challenging and difficult this year has been. And I want to acknowledge all the efforts and the hard work of so many of us. It is very appreciated. Down on the precautions that we can each take. We need to continue to work together and help protect one another.
Thank you, Dr. Wong. We'll now hear from Chair Karen Redman. Go ahead, Karen.
Good morning, and thank you all for being here. And thank you, Dr. Wong, for your continued advice and leadership. As Dr. Wong mentioned earlier this week, the province released a new framework for COVID response. I also spoke earlier this week with Minister Elliott, and I believe this new framework will balance our community's health and safety with economic recovery. It provides greater clarity on decision-making process of the province and what the province will be using to impose and manage restrictions. We have received indication from the province that Waterloo Region will likely move to the protect category effective midnight on Saturday. By implementing these measures, we will prevent spread and further closures. The plan will be to remain in this stage for 2 incubation periods or 28 days, but this is subject, of course, to change should the rates escalate quickly. As we learn more about these new measures and the changes required for Waterloo Regional businesses, Regional Council as the Board of Health will work with Public Health and Best Waterloo Region to get the information to businesses in a responsive and timely manner. If we want businesses to remain open, we must follow the measures of regular mask wearing, proper physical distancing, hand washing, staying home while sick, and not letting our guard down when around family, friends, or coworkers. Yesterday's provincial budget provided a 3-year fiscal outlook for Ontario, recognizing that we are in unprecedented times. It focuses on the support needed to manage the pandemic, on addressing the COVID-19 challenges and economic difficulties. It supports key investments to deliver an economic recovery. In addition to the welcome Safe Restart funding, municipalities are looking to this budget for long-term commitments from the province on transit, affordable housing, broadband, long-term care, and infrastructure funding. We're pleased that within the budget's 300 pages, the word municipal is found over 140 times, reflecting a great deal of focus and priority placed toward Ontario municipalities. Earlier this week, we learned that the region's $4 million allocation under the COVID-19 resilience stream from the province and federal governments under the Investing in Canada Infrastructure Program. This funding will be used towards shovel-ready projects with construction to commence and finish in 2021. Projects may include updates to health and safety-related projects in our long-term care home at Sunnyside, active transportation projects like our new LRT crossings, or further safety enhancement to regional buildings. One of the region's key budget submission asks that came out of our COVID-19 Recovery Committee was to accelerate the reduction of education tax rates in Waterloo Region to provide tax relief to all commercial and industrial businesses and to reduce the interregional tax disparities. The education tax rate is the largest component of the non-residential property tax bills in Waterloo Region. The commercial and industrial property tax rate is higher here than the provincial average, putting us at a competitive disadvantage. The budget announced that the government is lowering the business education tax rates in recognition of this long-standing municipal concern. These rates will be lowered, and the province is expected to adjust payments to school boards to offset the reductions in the education property taxes. The region is pleased to see mention of local infrastructure projects, including Highway 7 between Kitchener to Guelph, Highway 401 widening between Hesper Road and Townline Road in Cambridge, and the two-way all-day GO service on the Kitchener line. The budget mention of the two-way all-day GO was a clear and welcome sign that the Toronto-Waterloo Region Innovation Corridor will play a key role in Ontario's economic recovery. The budget's inclusion of the milestone projects on the transformation of the Kitchener GO line, including completion of the first tunnel in August and completion of the second tunnel expected in December, further signals to us the government's commitment to this project. Recently, the region partnered with the University of Waterloo's School of Planning to research how COVID-19 might impact the future of our community. As soon as we accepted the pandemic as part of our new normal, we reached out and asked the university to help us answer the question: how has this pandemic changed our community, and how can we shift our development practices to address it? The university looked at the economy, infrastructure, housing, and social implications. A virtual research symposium was held in August, and the papers are now posted online. The research papers included 13 recommendations, many of which we plan to use in our review of the regional official plan. For example, we need to plan for more private and public spaces in cities and urban growth areas. To secure local food systems, we need to protect existing farmland and farm practices. And we plan to look at a 15-minute city approach to create complete neighborhoods, pedestrian-friendly, transit-oriented, mixed use, and mixed housing types. Another research paper was written on how municipalities can build relationships with Indigenous nations, and this has been shared with our Indigenous Relations Working Group. Some of the research is already being used at the region, and I want to thank the university for their expertise and partnership in helping us to ensure we continue planning for vibrant communities. This year continues to be a year like no other, and Remembrance Day will be no exception. This year has brought special challenges in marking Remembrance Day, particularly in the cancellation of ceremonies and/or moving them online. This has inspired our local Waterloo Warbirds to honor those who have served by flying over all 9 cenotaphs in Waterloo Region and Guelph, plus 3 major cemeteries, the Mount View in Cambridge, Mount Hope in Kitchener-Waterloo, and Woodlawn in Guelph, all of which have significant war memorials and are the final resting places of service members. The 5 historic planes and 4 jets will take flight between 10:30 and 11:15 a.m. on Remembrance Day. This year's, please put health and safety first while observing Remembrance Day. We can all pay tribute by wearing a poppy and financially supporting the Royal Canadian Legion, wearing one of the Remembrance Day masks being sold by the Royal Canadian Legion, observing a moment of silence at 11 a.m. on November the 11th from home or wherever you are, and joining the online ceremony from Ottawa's National War Memorial, where the region of Waterloo will proudly have one of the many wreaths placed in honor of local veterans and service members. Thank you.
Thank you, Chair Redman and Dr. Wong. I'll now provide you with an enforcement update, and then we'll get to your questions. So we continue to respond to complaints and phone calls about both the face covering bylaws as well as general issues regarding the act. And we always do follow up with those calls. We did have 2 charges issued by the City of Waterloo bylaw, one on October 31st and one on November 1st. They were both tickets that were issued to occupants of private residences at $880. And they were to do with fail to comply with the order. And this was due to gathering limits being exceeded. So any further information about that, you should connect with the City of Waterloo bylaw. So that's the enforcement update. And now I will turn it over to you for questions, and we'll start with Kate from CBC. Go ahead, Kate.
Thank you. I just have a question about moving to this protected section. Are we moving from green to yellow, or is it just that it comes into effect this weekend? Like this new system, the new color-coded system?
Today, the province will announce, I don't know when exactly, but maybe at the usual press conference the Premier has at 1, the final categorization of regions into the various categories. So what they released on Wednesday was a draft. And they said it was based on older data, and that they will review new data that's come in more recently for them, and that they will make a final decision, which they will release on Friday. So if we're moved to yellow, then that comes into effect at midnight Saturday.
And in terms of that, and seeing the cases double today, earlier today, Dr. Wong, you kind of said you were expecting some cases to go up, and we weren't seeing the spikes. But you know, for you to see it double now and the cases this week, like, how are you feeling about that? Like, you know, do you kind of feel like, oh gosh, here we go?
I'm concerned. We saw this earlier in September when our cases started to increase quickly. Obviously, this is more significant just in terms of the numbers, even, right? A doubling of our daily numbers, which already increased compared to the month of October. So this is what can happen with COVID. This is why I'm always watching, and I get concerned whenever I start to see an increase, because it's really hard to go up and then maintain that level. What usually happens is it does this, it rises in an accelerated, even exponential fashion. So that's why it's really important to try to prevent things from escalating further once you start to have an indication that it's going in that direction, right? And it can often seem like you're overdoing it when, you know, it starts to go up, because people think, well, it's not that bad yet. Well, that's when you have to act, because once it goes up and once it's at a double the rate or triple the rate, it's going to be a lot harder. It's going to be many times harder to try to bring that down again and try to stabilize that. And so that's why with COVID, there's this fine balance, right, that we have to maintain. And that's why the province came out with that framework as well, so that people, you know, understand if you start to move up in those categories, in those indicators that they use to determine the categories, the purpose of doing that is to try to prevent you from continuing to accelerate in your numbers and then end up in a higher category. So if we look at the categories that they released on Wednesday, where we are right now in terms of limitations and you know, restrictions, we were at the lowest level in Ontario before, right? The stage 3, which is what existed before this new framework. But if you look at the green, there's even less restrictions. It's a loosening of the restrictions compared to yellow. So we have restrictions already that are under yellow. And for us to move or to stay in a color that has less restrictions at a time when we're accelerating, I don't think that's a good idea. And so the purpose to move us to a protect zone would be really to protect our gains and to help prevent us from moving into more restrictive zones in the future.
And in terms of, I know the color-coded system was getting a little bit of criticism this week because they were saying that to get into red or gray, the levels of cases or the acceleration of cases, it was too high, basically.
The threshold was too high.
Never go into red. And I'm wondering, on a regional level, whether you might consider putting restrictions that would be considered red into play in the region if we weren't actually in red on the provincial scale.
Thank you for the question. So as much as possible, we'd want to work with the province. The province announced some economic support for businesses that are that would be affected by restrictions according to the framework. They would only apply if the province puts a region into a certain zone, not if the local medical officer adds restrictions, right? So we would want to work with the province. To date, they've been wanting to support us. That would be what we would pursue as a first step. In terms of the first part of your question, first of all, I appreciate having a framework because we didn't have one before, and this is helpful in terms of giving us a line of sight of what might be possible and what might come down the line if our rates continue to accelerate. So that's good. In terms of if the thresholds are too high, I think we will see how the framework works earlier with regions like Toronto and Peel and other regions that have higher rates than us, right? I think because they're already in the orange and, potentially red. I don't know if any are in red right now, but those regions are already in the higher levels. So if it's not working well and there needs to be an adjustment to those thresholds, then I think we'll see that first in those regions. My focus right now is really to help our community try and stay in yellow if we're moved to yellow.
Okay, thank you very much.
Thanks, Kate. We'll move on to Joanna from the Record. Go ahead, Joanna.
Thank you. So Dr. Wong, it sounds like you welcome the region moving into the yellow category?
Yes, I fully support that. The green category is less restrictive compared to what we have now. Our rates are in line with the yellow category, and the intent of the yellow category is to protect our gains and to prevent us from moving into more restrictive categories. So yes, I fully support a move to place us in the yellow category.
And it sounds like generally too, sort of what's driving the increase in the higher case numbers is not sort of casual contact with people out in the community, but basically feeling relaxed around people you are familiar with, whether it's, your family, your friends, or your coworkers.
Yes, that's the hypothesis. We're not entirely sure why precautions, aren't taken in those circumstances or not always taken, but that's often what we see. We see when it's with friends, families, coworkers, cases tell us honestly, and we really appreciate this because it's critical in terms of being able to get at the root of the issues. That, they were very, very diligent with the patrons, for example, but they were not when they ate lunch together or when they had a break together. And so again, I don't want to blame or shame. And like I mentioned, anyone can get COVID. But if we take the precautions, we really minimize the chances of getting it and then spreading it. And so the key thing for people to understand is this is the type of risk we're seeing most often. This is what is often leading to spread, either close contact among, people that are outside of each other's households in familiar settings, like friends and family gatherings, or which I don't recommend at this time in person, and workplace settings, and also in events, like wedding related events, when you have lots of people, and the risk can be even higher because of the number of people. And then people just, even if they're in a place that has restrictions, they don't always adhere to the restrictions. And they tend to, not practice those measures with the family and friends, and spend a lot of time in close contact and with their masks off. So this is really what's driving it. And this evidence that we're seeing locally, this is being seen across Ontario, across the province, across the world. This is close contact is what's driving most of our cases.
So what would you like to say to people in the community about that?
Yeah, really, just really heighten the awareness among our community members that we need to avoid, to the extent possible, gathering with people outside of our household in places where there's large numbers of people, and in places where it's enclosed. So it's the same advice that I've given, but again, it's only have close, unprotected contact with those within your immediate household. With everyone else, even if you have a small gathering, with everyone else, maintain physical distance at all times, wear a mask. And during these times, try to limit the number of times that you gather with people outside of your household, even if you maintain the physical distancing. Try to limit the amount of time if it's in an enclosed space, or ensure that there's good ventilation if you're somewhere indoors. So those would be the key pieces of advice I would provide.
Thank you.
Thank you.
Thanks, Joanna. We'll move on to Nicole from CTV. Go ahead, Nicole.
Hi, Nicole.
Hi, good afternoon. I'm just wondering, with us moving into the yellow, you had suggested there will be more provincial help when it comes to education and enforcement and communication. Can we expect additional charges and more enforcement in these workplace settings that you believe people are not adhering to the measures?
I think what we can expect is more support from the province with respect to education and outreach and enforcement as warranted. So, I think our enforcement partners, and I'm sure that the province as well, when they assist, will continue to use their professional judgment in terms of when enforcement and charges, for example, would be warranted.
What would you say, or perhaps Chair Redman may want to respond to this, not sure who would want to, but a number of business owners in Waterloo who do have businesses that cater to the evening crowd, under the Protect Yellow, this means that their sales of alcohol and whatnot would be limited, and it would stop at 11 o'clock at night under the draft that we currently have. They're concerned that they will lose 70% of their business effective tomorrow. What do you have to say to these individuals and these business owners?
So I'll go first and then let Hsiu-Li jump in. I would tell you, Nicole, that businesses have been very compliant. Businesses have adhered to rules. One of the things the province did through the liquor laws is allow restaurants who have takeout to also have takeout liquor. So I think there's been an acknowledgement that while this is a huge revenue source, people tend to let their guard down when they're in big social gatherings, or they've been at a bar socializing for a while. So I think that restriction will has come with some ability for restaurants to do takeout liquor. So I think that they want to stay open. I think they want to continue operating their businesses and employing their employees. So I have no doubt that they will adhere to any change in any category that comes.
Yeah, I just wanted to mention that the restrictions that you speak of, Nicole, they're already in place. it would be that if we stayed in green, there would be no restrictions of that type. And I understand that it's a bit difficult for businesses. It's going to be difficult in particular for those businesses. I know that. But I don't think at a time when we're escalating cases, we should be loosening our restrictions.
What has our positivity rate been over the past week?
Oh, thanks. That's a good question. I was actually planning to update the group. So our percent positivity is now 2%. So we have continued to climb. We started out around 0.5% end of August, beginning of September. And we've slowly climbed. And more recently, we've climbed, I think I gave an update, must have been Wednesday. We were at 1.6, but then I got updated numbers last night, and we're at 2. So, that's in line with the escalation of our cases. That's what we would expect to see. The provinces, I don't have the province's latest numbers, but they have continued to climb as well.
This week, we saw another death as a result of COVID. Are you able to provide any details in regards to that additional death?
This week? You mean the one that was announced last?
A few days. Was it last week or was it over the weekend?
Yeah, it was the one, I think, yeah, it was announced, I think, about a week ago. Something like that, yeah. So, so we do know it was, somebody in their 70s who had underlying conditions. The risk factor in this case was travel.
And one quick question. I know in Aylmer, they have, there's plans for an anti-lockdown protest being held. The mayor there has asked for a state of emergency, and municipalities nearby, public health units nearby Aylmer have asked residents, please do not go. Are you sending out the similar message for people perhaps from Waterloo Region wanting to head down to Aylmer for that rally?
Yeah, I would never encourage anyone to attend an anti-mask rally. The advice from the province has been and continues to be, including in their latest framework, that people from higher transmission areas are asked not to go to lower transmission areas except for essential purposes. And now one of the things we have to just understand is that we do have essential travel between the GTA and ourselves, and we do have links to cases in the GTA because that's just the nature of the interactions when you have essential travel. Like, for example, people who work in the GTA and were exposed in the GTA but live here. So there will always be some level of interaction between people in higher transmission areas and those in lower transmission areas, if there were already those connections to begin with. But what we would ask people in the higher transmission areas to do is not to visit the lower transmission areas unless it's for those essential purposes.
I'll come back after.
Okay, thanks, Nicole. We'll move on to Tim from 570. Go ahead, Tim.
Thank you. Good morning. And I have a couple questions from one of my colleagues. Mark Perry's asking, what's your opinion of our retransmission rate and how much stock do you put into it in terms of decision making?
Sorry, I don't quite understand what he means by retransmission rate. Are you able to elaborate a bit further?
He's talking about the biostatistic graph, and he talked about it this morning in his news.
Oh, maybe he's talking about the effective reproduction rate. Right. Yeah, that's one of the criteria that's in the provincial framework. So basically what you're going to see the next time, we're actually working on posting that early next week. So on our dashboard, we're gonna have those stats that yourselves and the public can track. So anytime you're escalating, you're gonna have high reproductive effective reproduction rate, right? So if you're stable, you're gonna have around 1. If you kind of go up and down, but relatively stable, sometimes the R goes up above 1, sometimes the R goes, or it's RT, sometimes goes above 1, sometimes goes below 1, right? Basically what it means is if it's above 1, it's escalating, it's accelerating. If it's below 1, it's decelerating, it's slowing down. And so I fully expect that the next time we have R values, RT values, they're going to show we're escalating, which is just in line with the numbers that we've been reporting. So yeah, so what that means is when as I mentioned earlier, once you start increasing, that's the risk. And our support, the RT value supports that you're going to be at risk for an escalation, an exponential increase if the rates aren't slowed. So yeah, so we'll have that number, and it will be, I'm not sure exactly when it'll be updated, but regularly it'll be updated regularly on our dashboard, and it really coincides with what you're seeing in the community in terms of whether your rates are escalating or slowing down or remaining stable. I don't have it right now. And you know what? I wouldn't, even if I had it right now, I'd be cautious about giving it because our numbers have just climbed, right? And so I would expect to see a relatively high RT number the next time that we publish it.
Okay. And his next question is, biostatistic data suggests in Waterloo region, we have a 50% of chance of being exposed to the virus if we encounter 218 people in the next month, which is actually the same number seen in Ottawa, which is technically a hotspot. How concerned are you when you see data like that? And does this more or less reemphasize the message of being physically distanced and only going out for essential services?
What it emphasizes is, again, like, the 50% chance number of people, that's a statistical number, but really the highest, most important risks are close contact. So if people physically distance with people, with anyone outside of their household, and they mask, they will greatly reduce the chances of acquiring COVID and then passing it on. So those stats, yeah, we have to monitor this carefully, right? We have work to do to try to slow down our rates again, because our rates have started accelerating again. We did a great job after we started accelerating, and we knew about that in the community. We started to double down, and then we really lowered our rates. And you could see the province kept going up, and we stabilized and started to flatten the curve, right? So we can do it. We need to do it again, because now we're escalating again. And so we need to have a bit more time to see how the trends go, as well as to double down our measures and see if that has an effect. But certainly I'm concerned, because if we keep escalating at this rate, we will be in one of those higher zones, more restrictive zones.
And my last question is regarding the new framework. Dr. Wong, do you have any doubt in this new framework that has been released by the province? And do you think that anything, maybe some of the wording or anything, needs to be changed at all?
I would say that overall, I'm glad to have this framework. Having a framework is helpful because, as I mentioned, it gives a line of sight to what might be happening in the future. I think in terms of the thresholds for the different levels, I think we'll learn soon enough with the experience of regions that are at the higher levels to see if those restrictions that will be implemented will be sufficient to slow down the spread. We know spread is accelerating across the province, actually, but it's, something that we can impact, all of us can impact. And so we'll have to see, and I think we'll have that those signals coming from those areas that are under greater restrictions earlier. And our focus right now, my focus right now, is just to make sure that we can slow down the spread in our area so we don't have to move into orange or red.
That's great. Thank you so much.
Thanks, Tim. We'll go to Damon from Woolwich Observer. Go ahead, Damon.
Hello. So my first question is for Dr. Wong. With the new provincial framework, there's going to be restrictions placed on recreational events, and so like minor hockey per se, and they've been following a lot of the public health measures, doing their pre-screening. What message do you send out to the kids?
So we are awaiting the specific measures because that was just a high-level overview of the changes that would be implemented in the different categories. We're waiting for the specific measures that will be enacted in regulation that various sports and recreational groups would have to adhere to, or facilities that host these types of activities would have to adhere to. So what we've seen in sports settings in Ontario, although we haven't had an outbreak here yet, is that this type of setting is often at higher risk. But it's not only the actual play itself, it's also the before and after play, because there tends to be a lot of spread in social interactions or gatherings before and after play. But during play as well, it's a risk if players don't adhere to the distancing as much as possible. There are rules for all these sports and activities, to minimize close contact or minimize it for any prolonged period of time. But when people play sports, when they do strenuous exercise, they're not required to mask. And so that, and it may be difficult for them to mask because they're exercising more strenuously, but that's also circumstances that we know increase the risk of spread when people are exercising strenuously and they're exhaling forcefully. So that's why we need to make sure that precautions and restrictions to the extent needed are put in place in those settings. I would say from what I've heard, because I know our staff have been reaching out, with the great support of the municipalities, which I really want to thank, and helping us out a lot with this, getting into contact or passing the message on to sports associations, groups like that. We want those associations, those groups to know about the risks that we've seen elsewhere, because we're not going to be really different here, right? And if we're successful, we don't have a lot of outbreaks. So outbreaks only represent a fraction of the risk situations and a fraction of the cases. So we don't want to wait until outbreaks happen to do something. We want to take the learnings we've heard from other places about what has caused outbreaks in other places and apply them here. So we've been reaching out and providing information to make sure they're aware of the increased risks, to make sure that they're applying the proper precautions, which by and large, for the most part, they're doing, and they're doing diligently, and we really thank them for that. And then, and again, to reinforce that messaging with their families and with their staff, because we know that oftentimes the transmission can occur before and after games.
Okay, and then my next question, with today's numbers expected to almost double, how long do you think it will take for people to start taking things more seriously and us to start seeing those numbers go down after these new measures are put in place and seeing these numbers?
Yeah, I think by and large, our region has taken it seriously, and a lot of people have been trying to do their best. I think, what can happen with COVID and how easily it spreads, especially in close settings with lots of people, is you can have these increases, and they can accelerate rapidly. And so the best thing that we can do as a community is individually, we each continue to double down and maintain, if we've already doubled down, maintain those public health precautions, individual precautions that I've talked about. And there will need, once you have a certain level of spread in the community, which we have now, because when you have those numbers, that number of cases, you have spread. Once you have a certain level of spread in the community, you are going to need to put in place some broader community restrictions, which would come, with being in the yellow zone. And if needed, we would go to higher zones. But so it's a combination of those community-wide measures that are implemented through the framework and our own individual efforts as a community. And, we all can play a part, and we've seen how effective we can be when we all play a part. So just going to keep trying to pass the message out that that's what we need to continue to do.
Okay, and then with this new provincial framework, a lot of the proposed restrictions, we're seeing a lot of the transmission, like you said, among close contacts, household. So will this actually, do you think this will actually improve our numbers if people follow, or do you think there needs to be further restrictions put out?
Yeah, I think what's been sometimes communicated in the press is, well, there haven't been outbreaks in particular settings, so those are not at-risk settings. I think that's not the full picture, because evidence doesn't only come from outbreaks. Again, public health and other, like all of us, are doing our best to prevent outbreaks, right? So when things are working, there are less outbreaks, and outbreaks overall only represent a fraction of the spread. So we have to look at the body of evidence, and included in that are, studies that have been done that show that when you're in an enclosed environment with people and you can't wear masks because you're eating, you're drinking, or you're exercising strenuously, you are going to be increasing the risk of transmitting the virus if you have it, or acquiring it if someone that you're in close contact with has it. So those are higher risk settings. And so it doesn't mean we can't mitigate the risk, and we can, and we know that those various businesses are doing their utmost to try to mitigate in those settings, which is really helping, which is really helpful. But in terms of the broad-based measures, there's a certain level of restrictions that will need to be applied in those higher risk settings that we know are intrinsically higher risk because of the inability to always practice the distancing and the masking.
Okay, great. And then I was just wondering, Julie, would you be able to provide us with Dr. Wong's opening statement, just because it was cutting out a bit earlier?
Oh, sure. They all go on the website in the afternoon, right?
Yeah, they get posted on our website under media briefings, but I'll send you the link
Send
just
it
so you
now.
can find it.
Yeah.
Yeah, for sure.
Perfect. Okay, thank you so much.
Thanks, Damon. Okay, Irene, last but not least, Irene from Air News. Go ahead, Irene.
Thank you. Brant County Public Health has named another business in the county with the COVID-19 outbreak. Is there any pressure on Waterloo Region Public Health to take the same action?
We're going to stay the course, and we're going to do what we feel is appropriate. If there is no risk to the general public, or we don't need the general public to self-identify as a high risk or a close contact of a case associated with a business, we are not going to disclose the name of the business because there is not a need to in order to reach the people that may be at increased risk. And there's potential harms to disclosing names when you do not need to, including privacy risks. And what there may be times when we'll need to disclose the names, and in those cases we will not hesitate to do that if we need to. But if we don't need to, for example, because the risk, as it is most often the case, is not from the employee to the patrons, but from the employee to another employee or employees, employee-only areas, for example, then those are cases where we will stay the course, and we will disclose information about the type of setting that they've been identified in, so people can understand the types of settings that put people at increased risk and lead to outbreaks. But we will not disclose more information, including the name, if we don't feel that it's warranted.
Okay, that's great. Thank you. So that we know in Waterloo Region, any business that we go into is perfectly safe.
No, what we're saying is that when you visit a business like any other public place, right? Unless we've identified that it's a setting where you could be at increased risk, you need to assume that the level of community transmission that you have out there is the level that you could experience as well in any setting. And that's why people need to continue to distance and mask, in particular in indoor settings, including in business settings.
Okay, thank you. And as far as the province's color-coded assessment, I've been looking to find a link so that I can see the different assessments. Is that link available to the media? I couldn't.
That link is available. It's on the Government of Ontario's website, actually. And I think Julie can send it to you guys after. Okay. The government's gonna likely make an announcement later today, very soon, maybe. And so they may even have updated information too, because that framework, it was the initial proposed framework. So, I would watch for that as well. But they've posted it on their government website. So any updates should be there as well.
Great. That's it for me. Thank you.
Thanks, Irene. I'll send you that link after. So we've gone through the group once with questions. Are there any follow-up questions? Nicole got her hand up fast there. Okay, Nicole, go ahead.
Can you help clarify the dates of when we will fall into the yellow zone? Is it midnight, like 12:01 starting tomorrow, or 12:01 a.m. starting Sunday morning?
To confirm, let's wait to see what the province says.
Okay.
We can only go for what we think is likely to happen at this point. But I mean, Chair Redman mentioned it earlier. She could, repeat what she heard from the province yesterday. But since it's going to be very soon that we'll hear, maybe best to just wait. I don't know, Chair Redman, if you want to say anything.
Yeah, my understanding was that it will be midnight on Saturday. So midnight Saturday before it turns into Sunday, right? So 12:01 Saturday night. But I would agree with Dr. Wong. A lot of this is good information, but I think it's also a moving target. And I would also underscore, not only is the framework welcome and meant to bring clarity to everybody in the province is continuing to consult and talk to medical officers of health like Dr. Wong, and as well as municipal leaders to find out what the right process is to go forward. So I assume the regulations will clarify a lot of things, and they have not been released as yet.
Yes, I anticipate we'll get questions from businesses about the exact requirements, which haven't been laid out in that framework today. So the hope is either today or in the few days that follow, we will get those exact regulations, and then we'll be able to send them out to businesses, but they'll probably be getting them directly as well from their own associations.
Okay, and Dr. Wong, you said something earlier that we've managed to flatten the curve when everyone else was rising, but now we are escalating. Are you comfortable with saying Waterloo Region is entering a third wave? then?
No, I would say this is still our second wave. This is still our second wave. There can be periods when we flatten and then we go up again, and and we can flatten again. So we're still in the second wave, and really the wave call, so to speak, is because we're seeing this across Ontario, and this is a period when we're going to be entering a period where more people are going to be going indoors and gathering, right? So it'll be even more important that people keep up with those precautions, because the risk in indoor environments is higher than in outdoor environments. So we're still in a higher risk period, and so we would still be in the second wave. It'll only be if, for example, ourselves and the province, we see really we've flattened, and not only flattened, but basically we're no longer in a wave per se that we would, and then there's a period of stability, and then there's another acceleration. It would only be then that we would talk about a third wave. Sorry, that's a little bit maybe too long, but we're still in the second wave.
Okay, and my third question has to do with the outbreak related to the wedding event. There's 18 cases listed. Can we expect that to jump today? I believe there was 18 cases linked to the wedding. And if they're not all from Waterloo Region, how many cases altogether then are related to the wedding? Like how many more outside of the region?
I don't have those latest numbers on me, but the large majority of the cases are on residents outside of our region. So this is what you can often see with those types of events, right? You have a lot of people coming in from outside of our region.
So the 18 then, they live outside our region then?
Most of them do. The large majority of them do.
Okay. And last question, hospitalizations, they've gone up a little bit. You didn't talk about that yet. Are you concerned about our current hospitalization rate in Waterloo Region?
Yeah, I'm always concerned, even though they're not that high right now, whenever our cases go up, because it's always followed in the couple of weeks or 2 or 3 or 4 weeks after, with an increase in hospitalizations, with ICU admissions, and potentially with deaths. We've seen this elsewhere in Ontario. We've seen this in the first wave. There is no reason to think that it would be different here. So that's why, even if our hospitalization increases lag behind our case increases, we have to do everything we can to try to flatten the number of new cases that arise, so that we don't continue to see hospitalizations increase. Because it's not just the hospitalizations for the COVID patients that the healthcare system has to try to manage. It's all those other procedures and surgeries that they're trying to not only keep up with, but they're trying to work on the backlog that's developed from the first wave, right? And so hospitals are working tremendously hard on trying to accelerate, in some ways, the number of procedures and surgeries that they have to do, at the same time being able to cope with COVID cases. So right now they're managing, but if we continue to climb and do so in a significant way, then there's going to be added pressures, because they'll have to, not only take care of those COVID patients, but also all those other patients that are hospitalized for non-COVID reasons.
Are you able to quantify a number once like hospitalizations increase? Is there a specific number that could jeopardize those other procedures and put our local healthcare system, hospital system in jeopardy?
I wouldn't have those specific numbers. I wouldn't be the best person to speak to that, but I doubt there's a specific number, because the hospitals also have surge plans, and they also have, they will work to the extent possible to try to continue to care for all patients. And so there are different plans that they may enact, but you could follow up with the hospital contacts about that. They would be more able to speak to their plans.
That's it for me. Thank you.
Thanks, Nicole. I know Kate had her hand up, but she's disappeared from the scene. Anyone else have questions?
Oh, Kate sent Irene the link
Yep.
to the framework. Okay,
It's
sorry.
in the
Hi,
the
Kate.
chat, Irene.
Chat.
Thanks. That's good
Sorry.
teamwork. Okay, Kate's back,
Teamwork.
and I see Damon has a question. Go ahead, Kate.
Sorry, I just had a quick question about the graphic. Where is that going to be posted on the website?
So we've already tweeted it, and yeah, so you can grab it from our social media. And I'm not exactly sure where it's posted, but if that isn't enough, just send me an email and I can send you the graphic as well.
Thank you.
Damon?
I was just wondering from Dr. Wong if there was an update on flu shot availability in the region, if we know if we're going to be getting our next doses.
Apart from the, the general information that we've been given for the province that, they continue to work on sending more doses our way, and, that people should try to continue to get an appointment in the future. I myself am on a wait list and trying to, waiting for the doses that are going to be coming. The province has indicated that they would be best able to speak to that question because we wouldn't have any more information to the province, but we do know that there are more doses coming. They are definitely aware of the demand in our region because we keep keeping them informed about that. From all I've heard, they're trying their best to get out the doses. To date, there have been over 5 million doses distributed in the province. And the amount of doses that has been distributed so far is coming close, or is a significant. I don't remember the statistics. Again, the province would have this, but it's coming close to the total number that was distributed in the whole season last year. So there's been a great demand, as you can see, which is wonderful. I'm so glad so many people have gotten their flu shot. You have no idea how happy I am about that. However, because of the size of the demand, which you can see from that, we never have a situation where we have all the doses all available at once. They always come, staggered, and the bulk of the vaccines are delivered in November, because we leave October for the higher risk groups and for the long-term care homes and retirement homes, places like that. So the bulk of the vaccinations are generally given in November. And so we can expect that, more doses will come in, and, just thank people for continuing to be patient and trying where they can to make appointments, or be on a wait list, because sometimes the pharmacies or whatever, the practices need to put people on a wait list because they're not quite sure when their supply will come in. To get on a wait list or make an appointment with the pharmacy or with your family doctor or walk-in clinic that's providing those doses, and hopefully the supply that will come in hopefully soon will meet that demand.
Thank you so much.
Okay, any other questions? No? Okay, seeing none. So we can conclude today's media briefing. Thanks to you all for joining us today. And I hope that you have a great weekend and a safe weekend. And we'll see you back here next Friday. Take care.